So I'm Dr. Sandeep Bhasin from Co2 Medical Center. Today my topic is pregnancy stretch marks and how we can treat it. Pregnancy is a normal thing and females gain weight, their abdomen size becomes big, and after delivery their size becomes smaller and they lose weight also, but what is left is sagging skin and the stretch marks. And there's a very big question in many clients and patients: how do we deal with these pregnancy stretch marks? What can we do about these pregnancy stretch marks? There are various techniques that can be used for the pregnancy stretch marks. Like the first technique that we prefer to use a lot in pregnancy stretch marks is Co2 Fractional Laser. Co2 Fractional Laser is an ablative laser and that can help in scar resurfacing, and we use this Co2 Fractional Laser once a week and we do about 7 to 8 sittings. For small scars this technique is quite good, but in many conditions we have to combine Co2 Fractional Laser along with microneedling RF. So microneedling RF with CO2 fractional combination will give a good result in case of pregnancy stretch marks. And sometimes to improve the result further, we have to use chemical peels like DCA Field with occlusive dressings. So DCA peel can be another thing that we can combine along with fractional laser and microneedling RF. So the deep peels are very helpful to increase the collagen formation and decreasing the wrinkles there. One thing that I am using very often is Carboxytherapy, where we take carbon dioxide gas and give injections of CO2 gas subcutaneously and intradermally to improve the scar formation and to improve the vascularity of this area, and those pregnancy stretch mark can become less if we are using the Carboxytherapy. So that's another modality that we can use along with this chemical peel, along with microneedling RF and fractional laser. There is another thing that I combine sometimes is the skin is very lax and sagging, then we have to do tummy tuck or abdominoplasty in such patients. So tummy tuck is being used in such patients along with these other modalities for the pregnancy stretch marks. We also give some topical ointments like retinols, like glycolic acid and other skin firming agents, anti-wrinkle cremes, good anti-wrinkle creams along with them to help us to decrease the formation of decrease the pregnancy stretch marks. So these are various things that we can do surgically, non-surgically to improve pregnancy stretch mark, and now we are using PRP injections also on the skin to improve the pregnancy stretch mark. And when we do all these things, we can say that we can reduce these stretch marks by about 30 to 40%. They cannot totally disappear, but there's a good chance that they would become less and less noticeable and more acceptable for the patient, for the client and for the people around if we use all these techniques in combination. So thank you friends, I am Dr. Sandeep Bhasin from Co2 Medical Center.